The clever thing about this project, which was the brainchild of Jean DeClercq and his colleagues, was the creation of this group of women called subfertile, who are women who did not have IVF for a given pregnancy, but did have some indication of subfertility. And being able to separate that group out and compare them to both IVF pregnancies and fully fertile pregnancies, we were really able to tease out that confounding effect of underlying health issues and underlying subfertility. So what we did was to link data from the Society for Assisted Reproductive Technology. So they collect every cycle of IVF treatment, whether or not it produces a baby, is collected by them and reported to the CDC. We took the data from them for Massachusetts and linked it to all of the births that we had in a data system called PEL in Massachusetts. And PEL links Massachusetts births to hospital discharge at its core. So we linked these two data systems together, and in so doing we were able to identify exactly which babies in Massachusetts were the product of an IVF cycle, because we got to take Jane Smith from over here and we linked her to Jane Smith over here, and the birth dates matched, the treatment cycle matched with a plausible sort of associated baby, and we were definitively able to identify which babies were IVF babies. We were also able to take Jane Smith's prior medical history, which we have in the PEL data system, and see whether she had been admitted to the hospital for endometriosis, or even whether she had had a prior IVF cycle that maybe was unsuccessful or was associated with a different baby. But for this baby, it was a spontaneous birth. In doing that, we can see what Jane Smith's medical history is a little bit, and able to identify whether her current baby was a subfertile baby or an IVF baby or neither, right? So it's this, in linking these disparate databases, we can really kind of triangulate and see who's who. And whereas if you just look at the birth certificate, there's a checkbox for whether this was an ART baby or whether we had, whether the mom took drugs, fertility drugs, but it's not a definitive identification, because a lot of people don't want to identify on the birth certificate that they had an ART baby. There's a lot of privacy issues there. So it's not a really reliable source of information about ART. And when you link the data, you can really see that, because you see a lot of babies who we identified as ART babies are not identified on the birth certificate.